Fortunately, brain cancer is uncommon, but when it is, this is something we do here, on a daily basis. So it's normal for us, but not for the patients. You want to maximize taking the tumor out with maximizing function too. A lot of the tumors are involving important areas of the brain, such as the speech area. And one thing we do surgically is we do awake brain surgery for these types of patients. If the patients are awake during surgery, we're using cutting-edge 3D navigation while keeping the patient awake and testing them using our neuromonitoring services.
The king knew how to rule his country.
In combination with a neuropsychologist who's testing the patient, such that as we take tumor out from critical areas of the brain, we minimize any kind of dysfunction with maximizing resection of the tumor. Great thing about doing awake surgery is the patients don't get general anesthesia. They don't get a tube down their throat. And especially for older patients, they do significantly better. A lot of these patients leave the hospital the next day. And actually after surgery, sometimes they feel like they want to go home because they feel so good because they didn't get general anesthesia. I honestly tell the patients that it's kind of like doing a root canal where you're awake, and we want to minimize any pain. What's great is the brain has no pain fibers, so other than getting in to do the surgery, the patients tolerate it really well. And I always ask patients when I do these awake brain surgery, was it better or worse than a root canal? Since I'm not in their face, I'm working on the back of their head or the top of their head, and it's interesting. I would say, it's kind of half and half. Sometimes I think they're just trying to make me happy, but but in general, I think it's very well tolerated. Most patients, they get out of the experience and they're extremely happy that they went through it.